Hi, welcome to my professional philosophy of health education for HSC 6037. I am Jeannie Byrne Michelucci, and I am a senior graduate student at the University of Florida. What is health? According to the World Health Organization, health is a state of total physical, mental, and social well-being, and not merely the absence of disease or infirmity. It's really a holistic balance of all facets of life: the physical, intellectual, spiritual, social, and emotional. Health is dynamic because it exists in varying degrees, ranging from excellent to poor. That sometimes gets tricky when you're talking about people with disabilities or chronic illness because their best health is different from, say, an athlete's best health. Therefore, health is somewhat tailored to each individual. The Joint Committee has a book of medical terminology that's useful in defining terms related to health education. It defines health education as any combination of planned learning experiences using evidence-based practices and/or sound theories that provide the opportunity to acquire the knowledge, attitudes, and skills needed to adopt and maintain healthy behaviors. A health education specialist is an individual with a minimum of a bachelor's degree who serves in a variety of settings and is able to use appropriate educational strategies and methods to facilitate the development of policies, procedures, interventions, and systems conducive to the health of individuals, groups, and health education has been around as long as history, with people passing on ways to stay healthy. For an example, I can imagine a Neanderthal woman grunting to her friend, "Stay away from that rotten meat, it'll make you sick." Or a Neanderthal man communicating to his family, "Hey, when I chew this herb, my stomach feels better." But organized public health is only about 100 years old. Today, these are very exciting times for health education, with the profession being right on the cusp of coming into its own. But there are a few barriers that are hindering the development of health education and promotion. First, the profession is suffering from an identity crisis. Some confusion comes because of the many different names for the profession, such as health coach, patient navigator, patient activator, patient advocate, chronic care manager, community health worker, and care coordinator. Reimbursement for health education services is also a problem. And sometimes the reimbursement depends on the job title, but many insurance carriers do not pay for health education, and therefore businesses, schools, communities, and medical clinics who need to employ a health educator are burdened with the costs of employing them, and they might lack funding that. Also, health education and promotion is not taught at many colleges and universities, which could make it difficult to find a program for advanced training. There's also a big pay disparity between job titles. I looked at some salaries of the different job titles, and different websites have different pay scales, but I looked on ZipRecruiter to keep things consistent and to compare apples with apples. And I found that a health coach can make an average of $44,000 per year, while a health education specialist can make $54,000 a year. A nurse educator can make $76,000 a year, and a diabetic educator can make about $80,000 a year. And if we want to attract quality health educators, there needs to be consistent and competitive salaries. So, because of all these barriers, health educators must advocate for our profession. We must share our evidence-based interventions and outcomes with other health professionals, medical professionals, stakeholders, and partners so that they can see the benefits of health education. My personal belief about health education is that it should be available to everyone. I believe in equality, justice, and inclusion. As a health educator, acceptance is important as well. If your beliefs and values are different from your patients, you should never let that change how you treat that person. You should accept them for the way they are. It's also important to me to show kindness and empathy to all people and to try to see things from their perspective. And I also think health equity is important. So, equity is different from equality because it allows a person to get the medical health help that they need individually and not just have the same help as everyone else. So it implies that ideally everyone should have a fair opportunity to attain their full health potential, and no one should be disadvantaged from achieving this potential. The cartoon on the right illustrates this concept very well. It shows the difference between equality and equity. Finally, I strongly believe in service to others. It can really put your life in perspective, and it can give you purpose, and it takes away from your own problems, which for me are usually petty. Several experiences have influenced my perception of health education. As a child, I lived in developing countries because my father worked for the government, USAID, which is the United States Agency for International Development. And in these countries, I met and befriended some very wonderful people from all different cultures and ethnicities, and some I still keep in touch with to this day. So, this experience helped me form a sensitivity to cultural differences and an awareness of language barriers and literacy differences. And I strongly believe in social justice, equality, and health equity. In this picture, I'm with some of my brothers and sisters, and we are with Aboriginal people who live in the mountains of Taiwan. And I'm the goofy looking one in the yellow shirt. There's some other life experiences that shaped my opinion of health education. I grew up in a medical family. My mother and five of my seven brothers and sisters are nurses. And my husband, my son, my daughter-in-law, and my sister-in-law are all physicians. We also have two pharmacists and a social worker in the family. So basically, we could run a small hospital with just our family. Family gatherings are always full of medical stories and stories of interesting cases, but also cases where the current medical system is failing. So some things like people not being able to afford medications due to the high cost of drugs, not affording health insurance or lab or imaging tests, and the cost of health insurance is rising, but the amount of coverage is decreasing. So it lies on the patient to pick up the extra costs. I've been a nurse for over 37 years and I still love my job. There's a picture of me on the left at age 22. For over 30 years, I've run a medical clinic, and so I've seen healthcare from different viewpoints. There's the healthcare provider side, the clinical side, the business side, as well as the patient side. And there are so many problems in our healthcare system. The picture in the middle is of my husband and my 3 grown kids, and they're very healthy. Everyone's very healthy, but I feel like it's important to keep them that way. A great thing about health education and promotion is that it benefits everyone in society, and my family would benefit as well. The need for health education is great right now. The U.S. healthcare spending reached $35 trillion in 2017. And the cost of medical services and medications have skyrocketed. And there's also an increasing number of Medicare and Medicaid recipients. Because people are living longer and more sedentary, 6 out of 10 people have 1 or more chronic diseases. All these factors place a burden on our health care system. So health education is important to keep people healthy, out of the hospital and emergency rooms, to avoid illness and disability, and to prevent or manage chronic disease. The future of health education is wide open. There are so many different facets to health promotion, like educating people on healthy dietary and exercise programs, developing worksite wellness programs, planning and implementing evidence-based programs, training healthcare workers or lay workers, advocating and lobbying for health legislation, supporting community programs, working to improve health literacy and decrease health disparity, and the list can go on and on. The goals of health education are to reduce morbidity and mortality, increase wellness, and enhance quality of life. And here are just some illnesses and chronic disease that can be prevented through health education. Health educators can be found in many different areas: hospitals, clinics, health plans, schools, universities, state and local public health departments, businesses and industries, and nonprofit organizations. My role in health education is to expand the chronic care management program at our clinic and to take advantage of the CMS shared savings program that gives physicians and providers a portion of the cost savings they bring from keeping healthcare costs low. So things like keeping people out of the hospital, giving immunizations and flu shots, controlling blood sugars, using less expensive medications like generics, screening for disease like breast, prostate, and colon cancer can all keep costs down. Which, by the way, these measures are good for the patients as well. I'll be conducting needs assessments, planning health programs, educating patients on healthy behaviors, and I'll also train staff and co-workers on health programs as well. And finally, I will be an advocate for this great profession by talking about the benefits of health education, advocating health policy changes, and supporting health education organizations. Thank you for listening to my presentation, and I really look forward to hearing your comments and critiques.